Hi, this is Dr. David Tenner, and we are here at the Goldberg Clinic, where we specialize in helping patients reverse chronic illness of all kinds. And today we're joined by John Frady, and John came to see us back in October of last year, so October, November, December, January, February, March, April. It's been about 6 months or so. And John is here. He's going to share his story with us. We've had some excellent results. So John, I'm going to turn the floor over to you for a bit, and just tell our audience a little bit about what brought you in initially and what your concerns were.
Well, initially I came in with my wife Abby, who's had a history of chronic health issues that she's had to deal with. So she's the one that got me in here. I'll admit that, but I've really seen a substantial change since I've been here. I had some issues with liver enzyme elevation. Had some issues with looking at prediabetes and heart disease in my family history. So getting in here, really, that's what drove me, and also to lose some weight too. So we've been coming here for right at 6 months, I guess. Mm-hmm. So I've seen a substantial change, especially in the liver enzyme department, which was what I was concerned about at the time. So,
just for our audience, when liver enzymes are elevated, that's an indication that there's some kind of liver pathology, that the liver is under duress. And John's initial results, we have them right here, and we'll show them on the screen in just a second. John's blood chemistry showed that his AST and ALT levels were significantly elevated. Back in December of 2015, his AST was at 60 and his ALT at 140. The normal ranges there are 0 to 40 and 0 to 44, so there's a substantial increase there. And so we worked with John for quite a while, and he brought in the new result he just had done today, and both of those are within normal limits now. We've got the AST at 27 and the ALT just 1 point above the normal range, for all intents and purposes now normal, at 45. So John's really kind of out of the danger zone there. Things are looking really fantastic in that regard. It's a testament to the hard work that John has really put in with us. Now, just a couple comments about his family history. There's some diabetes in the family, some history of heart disease, and that was one of John's concerns also. We did some testing here with him. We found out that he was in the pre-diabetic, the early stages of diabetes. His hemoglobin A1C was high at 6, and that's a measure of blood sugar. And we also ran what's called an HSCRP on him. It's a measure of inflammation. It's also one of the best indicators for heart attack risk, heart attack and stroke. And his level was elevated initially as well. Just last night we got his new test results in. They're now looking fantastic. He is out of the diabetic range now. His hemoglobin A1C has come down, and his HSCRP has dropped substantially from a bit over 3 to now about level 1. Which is fantastic. It also means his risk for cardiovascular disease has gone down dramatically. He's out of that danger zone. John has done really well. He's worked very hard with us. He has been an excellent patient, and I'm sure his wife has something to do with that. His wife, Abby, is also a patient here, and she's done very well under our care as well. So, John, do you have anything you'd like to add about your experience with us, about the changes that you've seen? How are you feeling, by the way, different as compared to either before? I know your labs are better. How are you feeling?
That's a good point too. My energy level is a lot better. I used to get up in the mornings and I'd just be like, I gotta do this, and I really don't have that anymore. I mean, there's many of us that aren't morning people, but I can get up in the morning, really easily. I feel very balanced throughout the day. Before I thought I would peak in the morning as far as energy and everything, and then the rest of the day is just like, Mm-hmm. And now I'm much more balanced. I've had issues with sugar in the past, with low blood sugar and my concerns over diabetes. I have that in my family, much more balanced as far as that's concerned.
You lost some weight too.
I've lost some weight. I've lost about 15 pounds since I started coming here too. So,
John's done very well across the board. We're going to continue to build upon these improvements. We're not quite done yet. We're going to continue to move things in the right direction. And as we told John initially when he came in here, we saw that he had a variety of different issues: pre-diabetes, higher risk for heart attack and stroke in his family history, high liver enzymes. We didn't treat any of these issues. We actually don't treat any particular condition, even though people come to see us with virtually every kind of health problem. What we do here is work with each patient to identify what factors are causing their health problems in the first place, and then to do everything we can to build health. And when we build health, we watch all of these different things start to fall in line together, just as a natural process of the body getting healthy, right? As opposed to treating each symptom or each issue as if it were separate. We see these things as all interrelated. So we have John doing the right things now based on his history, his physical exam, and his lab work. And then we see everything balance out beautifully in his labs, and we see him starting to feel better all over. And that's the way we think healthcare should be approached. And at the same time, now we're teaching John what to do too, so he can start taking care of himself more and more, so he knows what he needs to do now to stay healthy and keep these labs the way they are, and actually improve upon them even further, and then to keep him moving in the right direction in terms of feeling better and better over time. So John, I really appreciate you sharing your story with us. I hope it will serve as an inspiration to other people suffering with similar issues. And let's keep it going. Let's keep up the good work.
Yeah.